Welcome to Centers of America, where you, the patient, and your back is our number one priority. We are here to serve you by providing you the latest of technology with the most updated research to provide you the quickest relief ongoing. Let's get you back in the game. Let's get your life back. I want to take this opportunity again to say thank you and to let's listen to what some of our Centers of America doctors have to say.
Patient care is number one with Centers of America doctors. This is what we are trained for. This is what we focus on. Number one is get the proper diagnosis. Number two, have the proper treatment. And number three, that will give that patient the results. That's why the patient came to see the doctor in the first place. They put their trust in the doctor. That doctor has to be very well trained. He has to be at the very top and know exactly what he's doing. And that's what I love about Centers of America. We give those doctors those skills. We teach them the research. We teach them in the master class how to convey that to the patient.
We want the patient to get one thing and one thing only, results. We want you to feel better. We want the patient to get their life back, to go back to lifting your grandchildren, go back to playing golf, go back to doing the things you love. We care about our patients at Centers of America, where the patient is our number one priority and number one concern. We continue to grow at Centers of America for one reason: we care.
Centers of America has trained me to be a caring person towards our patients. We want them to come in and feel comfortable.
Being able to relax and know that you're in good hands is, I think, one of the most important things. And if you are going to a place where you don't feel like you're in good hands and you don't feel like you have the care, the utmost care, then you're not going to come back and you're not going to listen to recommendations. So if we give them everything that we have and we treat them like family, then they're going to listen to what we have to say and they're going to know that we are out for their best interest.
I'm the one that actually deals with new patients, so every time a new one comes in, I will weigh them up and then I would figure out what their pull is depending on what doc says and things like that. I would start to get them suited up and I always ask them how they are feeling today because, I want to know how gentle I really need to be with each and every one.
You stand up, you get lowered down, they strap you in. Now that sounds like a lot, but it's very gentle strapping, it's very comfortable, and you're going to be on the table for about 30 minutes, and the table will gently pull and release, pull and release. And what it's doing is it's kind of like milking a cow. I tell people every time it pulls and releases, it pulls a little drops of moisture back into your disc that's dehydrated, that's degenerated, that's bulging, that's herniated. And it naturally pulls that disc back where it belongs. So you'll be on the table for about 30 minutes. No fear of it hurting, no fear of it making you worse.
After the treatment, we take them off of the table, so we undo everything. And we always make sure that we bring them up slowly, make sure they can get off the table okay. If we need to help them, then we'll be there for them.
Once you get up off the table, we're going to put you in the area and put an ice pack on your back for about 15 to 20 minutes. And then a lot of doctors like to use what we call a cold laser. The laser is like a magnet to blood. What it's going to do is it accentuates the healing process, it takes down inflammation in the body, and it gives you that relief that you're looking for. And once you've done that, you're going to go back up to the front desk. The doctor or the staff will give you a folder, and it's got very important information in there that you should read. I tell my patients that if they don't read through that information, when they come back on the second day, I will not see them, because simply I am taking this problem very seriously. Disc problems are very serious, and if you or your mother comes to see me, I'm going to take it very seriously. And that's what Centers of America doctors do. They want you to know and understand what your condition is, because then you can make a better decision on how to properly treat it. You don't go back down that road of pills, medications, shots, injections, failed back surgery. Those are all treating the symptoms. They're not treating the disc. And that's what Centers of America doctors do. That's why we stand out, and that's why we are committed to excellence in the disc treatment of injuries. That's what we're all about.
So it's very interesting. The reality is that we measure improvement both what we call subjectively and what we call objectively. Subjective, obviously, how the patient feels. Objectively, by what the tests, what the evaluations, what the examinations reveal. So what we often find is an improvement not just in the symptomatic relief, in other words, how the patient is feeling, but more in terms of what we call quality of life. The way they lift, the way they bend, the way they sit, the way they function, what we call the activities of daily living, and all of that, as a general rule, improves upon completion of treatment.
When you see a patient that comes in and they are hurting and they are angry and mad at the world because of that, it hits something deep down. We've all been there. We all know how terrible it can be to be in pain. And to be able to bring those patients in, treat them, show them love and care and support, and to be able to see them walk out of here, but sometimes not walk out of here, but dance out of here and enjoy themselves, and then be able to go play a game of golf. For us to be able to bring a quality of life back to people, it warms your heart. It makes you want to come to work every day, to know that you are not only, making people's lives better, but it makes you feel good deep down.
Thank you. Thank you for taking the opportunity to watch this video. We at Centers of America do not take you, the patient, lightly. Matter of fact, you are our everything. We're changing the world one disc, one patient at a time. Centers of America doctors are some of the most trained doctors in the United States on spinal decompression. Our clinics throughout the United States are focused on research from Harvard University, Johns Hopkins University, from the Mayo Clinic, even Stanford University. The best research, the best doctors trying to give you, the patient, the best results. So again, thank you. I want you to take this opportunity to sit back, relax, and know that you're in good hands with the Centers of America.
Disc Centers of America, a call to us can change your life.